Located in Ogdensburg, New York, along the St. Lawrence River, Claxton-Hepburn Medical Center is a 130-bed acute care facility that serves New York's largest county based on area. The challenges of operating a major medical center in a rural part of New York State are significant, but Claxton-Hepburn not only meets those basic challenges, it has distinguished itself as a leader in areas of patient safety and quality care.
I tell people that 126 years ago when they started this hospital, patients came here with really 3 expectations. It was, make me better, don't hurt me, and be nice to me. Now, we're very sophisticated now, but we call those quality, safety, and patient satisfaction. And so the same 3 ingredients prompt people way back then as they do now.
Starting in the intensive care unit, nurse manager Jennifer Shaver and her team established new practices on important clinical bundles to reduce bloodstream-related central line infections, ventilator-associated pneumonias, and pressure ulcers.
Call a rapid response.
They established a rapid response team to better coordinate urgent care, creating a visual scoreboard to monitor and share the data.
I started by measuring our compliance in those areas, not looking at farther outcomes, but measuring the compliance and sharing them with the staff. And they talked amongst themselves about, wow, we were 100% compliant this month in doing this, this, and this. And we've had no vent pneumonias for 1 year, then 2 years, then 3 years. And at 5.5 years, when we're getting calls from other hospitals asking to share our best practices, it was a real aha moment for everybody.
What really is important when you're a clinician is outcomes. So I'll buy into anything that'll improve outcomes, and I think most docs will. They are interested in outcomes. That's really the only way you can measure what you're doing and how effective you are. So how you feeling today? Good.
Like many of the caregivers here, Dr. Michael Seidman has been at Claxton-Hepburn for decades. Now the institution's chief of medicine, he's worked closely with the team to improve quality while managing the healthcare needs of a community with high incidence of diabetes, poverty, and associated health problems. Here, Medicare and Medicaid figure prominently, and over 55% of the hospital's expectant mothers are covered by Medicaid. But the hospital has never wavered.
Help people in need, regardless of their ability to pay. That's been who we've taken care of. And it's a rich history. That's really very critical to who we are.
And who they've become as a result of the quality care initiatives.
Patients are getting better care, they're getting in-house treatment, and they're comfortable with their local doctors.
Dr. Prasad Yida, a surgeon, came to the hospital right out of medical school for what he thought would be a 2-year assignment. 30 years later, he's still here because of his commitment to the community and the positive culture of the facility.
Any of my colleagues are in trouble in the operating room, we should drop everything and go and help them out. I even told once the whole hospital may have to scrub to help the doctor to save the patient. That indicates teamwork and safety of the patient.
Jason and Danielle Langstaff came to Claxton-Hepburn for the birth of their children. Then, months later, Danielle returned for a gynecological procedure. Unforeseen complications transformed this operation from something routine to something life-threatening.
She's lost this blood, and they brought her into ICU. And then I remember Jen Shaver, Mrs. Shaver, coming in, and she was very comforting in our time of need. Letting us know that we were going to be all right. It was almost like an extra set of hands.
I feel very fortunate that when a situation occurred like that obviously nobody thought was going to happen for a procedure like that. You go in for any procedure just thinking everything's going to be fine, when really you don't know. But to know that when something does go wrong, that there are nurses that really are watching and doctors that can handle that type of situation. It makes you feel safe. You're in good hands.
Claxton-Hepburn has also become a primary center for organ donation. The effort to help guide families through end-of-life conversations and educate them about organ donation is perhaps their toughest job.
It was a situation where not a lot of people that knew what happened wanted to talk about it, and here we're faced with a situation where we're finding out that our close relative here, my cousin, somebody's mother, somebody's sister, somebody's daughter was laying on a life support bed. Chances are probably not going to wake up.
It was the family that raised the option because of their history and their knowing somebody in their community that actually was waiting for a transplant. They said, could Ashley possibly be an organ donor?
You know, Ashley's got two beautiful girls. You know, someday I'd love to have them meet, you know, the people that Ashley may have saved.
The campus has really expanded from just the hospital itself to now with the Cancer Treatment Center, the medical office building, we have the renal center, the wound care center, clinics in the area towns around us. I think we've expanded our services to better serve our community. I mean, that is the mission of the hospital.
The community on the whole prizes their hospital highly. They put a lot of value in the hospital. They're willing to support it financially, and they're willing to put a lot of work into it.
And so are the people who work here. Learn more about Claxton-Hepburn's success story by visiting claxtonhepburn.org.